about summary and plans. Summary, as I said, that it's very important. Very important. Summary is very important. Um, what summary should include? Summary should include four things. It should be so two things from the history or three things from the history and one thing from the examination, if anything positive. If we don't have anything positive in the examination, then four things from the history has to be included in the summary. Apart from that, you have to have the two or three differential diagnosis in the medical term, and the next line after the diagnosis you should explain that in the lay language. Apart from that diagnosis, uh, you also have to include two things about the testing, like which test you're going to perform, and one line after that should explain the test in a should explain the test. So now I'll tell you the example. Suppose after completing everything, so and it should be like that. So Miss Jolly, thank you for answering all my question. So as you said me that you have a pain in the belly area which is located in the right upper quadrant and which is present since 5 days and which is associated with nausea and vomiting. Apart from that, you also said me you have fever since 5 days. So, and on examination, when I touch over your right upper belly area, you are having a pain. On the basis of this, it seems to me that you might be suffering from jaundice, which is, or you might be suffering from hepatitis. Don't say jaundice, you might be suffering from hepatitis, which is the infection of the liver, or you might be suffering from cholecystitis, which is the infection of the gallbladder. But to confirm my diagnosis, I need to do few tests on you, which will include a blood test and a picture of your belly. And as soon as the test results are arrived, I will come back to you and we will devise a management plan for you. So is that fine with you? The patient will reply accordingly and then say that. So, do you have any other question for me? The patient will reply. Okay, thank you. It was nice meeting you. Shake hand with the patient and leave the room. I know. How can I say all these things? These are all questions which I have mugged up. I practice a lot. You have to practice and see the closing part is very big. And the main thing I would like to say that I in closing, just remember paraphrasing after your first complaint. So as you already have paraphrased in the beginning, so in the end, here you can say that paraphrase here. Same. The two things of the history which you have paraphrased, you can again repeat it in the summary. So so means it will be on the tip of your tongue. You won't have to just see in the notes and do that and say. And it gives a very good report that you summarize while looking directly into the eyes of the patient. I used to do something like this also. That after completion, I used to say it to the after examination. I used to tell the patient that let me take a note of it, and I used to just have 5 to 10 seconds and just act out as if I'm writing, and then I used to look at what I'm going to say in the summary, and then I used to keep my notes aside and say all this what I say to the patient and directly. That's it. Is there anything and you have to include, you might be suffering, I said that's it, you test and explanation and